10 Most common signs and symptoms of vitamin D deficiency in adults. Vitamin D is a crucial nutrient that plays a vital role in various physiological processes in the body. It plays a role in the regulation of cell growth and differentiation, which is important for overall health. Vitamin D is one of many vitamins your body needs to stay healthy. It plays a crucial role in maintaining the balance of calcium in your blood and bones, and in building and maintaining bones. More specifically, you need vitamin D, so your body can use calcium and phosphorus to build bones and support healthy tissues. Vitamin D deficiency occurs when the body doesn't get enough vitamin D from sunlight or diet. Vitamin D deficiency can cause loss of bone density, osteoporosis, and broken bones. Vitamin D deficiency can be difficult to notice because symptoms may not occur for several months or years. Sometimes, you may have no symptoms at all. Keeping that in mind, it's still helpful to know what signs and symptoms to look for. Here are some signs and symptoms of vitamin D deficiency. 1. Bone and muscle pain. Vitamin D is essential for the absorption of calcium, which is crucial for maintaining strong and healthy bones. Low bone mineral density is an indication that your bones have lost calcium and other minerals. This places older adults, especially women, at an increased risk of fractures. A review of 81 studies also found that people with arthritis, muscle pain, and chronic widespread pain tended to have lower levels of vitamin D than people without these conditions. 2. Frequent illness or infections. One of the most important roles of vitamin D is supporting immune health, which helps you ward off viruses and bacteria that cause illness. Vitamin D directly interacts with the cells that are responsible for addressing infections. If you often become sick, especially with colds or the flu, low vitamin D levels may be a contributing factor. 3. Fatigue. People with vitamin D deficiency may experience general fatigue and a lack of energy. Feeling tired can stem from a number of causes, one of which may be vitamin D deficiency. Unlike more visible causes like stress, depression, and insomnia, vitamin D deficiency is often overlooked as a potential cause of fatigue. 4. Hair loss. Many foods and nutrients may affect hair health. If your levels of vitamin D are low, hair loss can result merely due to an insufficient supply of these cells. Vitamin D is a fat-soluble vitamin that plays a critical role in maintaining healthy bones, supporting the immune system, and regulating cell growth and division. 5. Weakened immune system. Vitamin D can modulate the innate and adaptive immune responses. Deficiency in vitamin D is associated with increased autoimmunity, as well as an increased susceptibility to infection. 6. Depression and mood swings. Some studies suggest a connection between low vitamin D levels and mood disorders, including depression. Low vitamin D levels are associated with increased symptoms of depression and anxiety. For this reason, vitamin D screening should be performed in the prevention and treatment planning of these mood disorders. 7. Impaired wound healing. Vitamin D is involved in the process of wound healing, and a deficiency may slow down this process. Prevalence of vitamin D deficiency in several countries including Indonesia is still high. While the role of vitamin D is very important, including accelerating the wound healing process, increasing the immune system, anti-inflammatory, and antibacterial. 8. Bone deformities in children. Vitamin D deficiency can cause babies and children to get rickets. Rickets is a disease that causes thin, weak and deformed bones. In adults, not having enough vitamin D and calcium causes osteoporosis, loss of bone density, and can lead to fractures, broken bones. 9. Muscle weakness. In addition to bone health, vitamin D is important for muscle function, and deficiency may contribute to muscle weakness. When vitamin D levels are low and the body isn't able to properly absorb calcium and phosphorus, there is an increased risk of bone pain, bone fractures, muscle pain, and muscle weakness. In older adults, severe vitamin D deficiency levels less than 10 ng/ml may also contribute to an increased risk of falls. 10. Weight gain. Having inadequate levels of vitamin D may correlate with unintentional weight gain. A study on women over the age of 65 found that participants with a lower vitamin D level experienced more weight gain. A systematic review of 23 different studies found similar associations between vitamin D deficiency and obesity. It's important to note that while sunlight is a natural source of vitamin D, dietary sources and supplements may be necessary, especially for individuals who have limited sun exposure, live in northern latitudes, or have specific health conditions that affect vitamin D absorption. If you suspect a deficiency, it's recommended to consult with a healthcare professional for proper evaluation and guidance.
Hope you liked the video and thanks for watching. Please don't forget to like, subscribe and support our channel Miss Healthy.